Sure. Today at the IWCLL meeting, we are going to present a poster presentation on this frontline therapy for patients with CLL. We designed this regimen called IFCG, which is kind of a new version of FCR to say. It has ibrutinib, fludarabine, cyclophosphamide, and GA101, which was the original name for obinutuzumab. We designed it specifically for patients with IGVH mutated patients without a TP53 aberration. So patients have to have an IGVH mutation. Patients cannot have a deletion 17p or p53 mutation. And we enrolled young fit patients with that genomic subset in this trial. And this was based on the hypothesis that these are the group of patients from our original FCR study led by Dr. Keating, showed that these are the patients who have long-term progression-free survival. And we think that half of these patients approximately treated with FCR with this genomic subgroup of patients may be cured of their disease because at 10 plus years they're not relapsing. The PFS curves looks flat, plateaued after 10 years. So we want to improvise on the FCR regimen, and we developed this regimen called IFCG, ibrutinib, FC, and obinutuzumab. I guess there are a few key differences from the standard FCR regimen. First of all, the chemotherapy is only for 3 cycles. So we don't give any more 6 cycles of FCR, only 3 cycles of chemoimmunotherapy. And after that, patients get additional 9 months of ibrutinib. And some patients get 3 months, some patients get 9 months of obinutuzumab. And at 1 year, which is another important endpoint, where if you are MRD negative, the patients will stop all therapy, including ibrutinib. So the data we're going to report today is after a median follow-up of 30 months for 45 patients we have enrolled in the study. Of the 45 patients, at 3-month mark, after 3 cycles of IFCG, we have an MRD negative rate in the bone marrow of 89%, which compares favorably to 26% we had with standard FCR. And notably, at 1 year mark, all 41 patients who have reached 1 year mark were MRD negative. So of the evaluable patient, 100% are MRD negative. On an intent to treat, it's approximately 90%. And again, we are following these patients now off ibrutinib therapy, off all therapy, and so far we haven't had a recurrence of MRD for these patients, and they are now off therapy for close to 1.5 to 2 years. So to us, this looks like a promising regimen. Again, it's a phase 2 study at MD Anderson, and we'll report the updated data today.